Raise a child, you need a village, and some of you may not remember that because you are living in big cities where the village is not raising a child, but in those times where a village was raising a child, you had everyone keeping a loving eye on a child, providing tools and providing direction. And I think with patient engagement is the same process, and it takes a community to create patient engagement.
We heard that it takes a village to raise a child. We also heard about the tools that that village has. And I just want also all of us to quickly reflect on the fact that although we say we're at the start of a new journey of co-creation here today, a continuing journey of co-creation, we have actually seen an awful lot of success in the last decade in terms of patient engagement. We've seen various frameworks come into existence. We've seen guidances be developed, whether they're at the topmost level on the principles of patient engagement, the quality that we can have or the quality that we can see. The tools that we need to do the jobs are also slowly coming out there.
I think, and I'm not the only one believing that, but patient engagement is at a turning point. So the tools are there, we have some massive movement by key stakeholder groups, so we also see that the practices itself are progressing day by day, so the people that are reviewing as part of PFMD or as part of Paradigm the good practices, they can see the evolution from where we were 5 years ago and where we are today. So there is already at the individual level, in silos, there is progress. It takes a village to raise a child. Actually, for the next 2 days and moving forward from now on, you are the village. And so it's up to you to make it a success and to raise that child. Thank you very much.
Paradigm is actually focusing on collaboration with HTA and regulators as one of the key decision points that we're actually unpacking in a great deal of depth, the whole area of early dialogue with patients, industry, regulators and the HTA experts.
Now we're at a point where the value of patient input really has been demonstrated, and it's no longer a question of why or if, it really is, okay, so when and who and how are these patients coming in?
We really need to understand better how patients want to engage with regulators, how they do it, but also what's important to them. When do they really want to engage with us?
The focus of our methods is to have the involvement of the patients in the scoping phase, so at the very beginning, so that really the input can be fed into the PICO.
Moving forward, I think we need to make sure that we are more systematic in involving patients. They are involved across the medicine life cycle as we talk, but there are still gaps. We need to further look at where they are not involved yet, and then how can we involve them.
I'm hoping to take home some messages to my agency back at home that I can feed into our patient engagement team about some of the aspects that we really want to really try and move forward to ensure that patient engagement is truly embedded in the work that we do.
Online session this afternoon talking about communications and cultural change. One of the very important things I heard as takeaway is if there is reluctance, we need to understand why, and we need to better understand what are the fears, what are the problems, why is the person reluctant to change things. We need to be equipped with answers to this, and we need to be equipped with some tools to make this happen and to make this easier.
I think probably the top three that we came out were around sort of some clearer descriptions of the criteria followed to identify patient representatives needed. That really came out loud and clear across those 3 sessions, so that's something we can certainly build upon. Including dissemination and communication plan, sharing both the process and the outcomes of that patient engagement initiative. And the other big gap was the lack of reporting on patient engagement practices per se.
There is a need to share what did you do, what did you learn, so that others can learn as well. What were those challenges and how we can avoid it if we are doing something similar. using the quality guidance actually gave us a framework to work together.
I think what the outcome is of the workshop is really that people understood the issue. Everybody felt, in a way, it's their thing. It's sometimes the administrative side, but it defines, do we co-own, do we co-create, or do the advocates just come and contribute and deliver and actually lose their right on the things that they do there? And I think that kind of discussion is very fruitful and very important.
There are no such things as incurable. There are only things for which man has not found a cure. And if there is one message that I want to leave now with my presentation, is that when you have a problem or idea of solving a problem, think that there are no things unsolvable, but just things that are looking for the right solution.
When we try to say we want to co-create, it's not just because we have wishy-washy people that like to discuss, and it's because actually the way to succeed in making patient engagement happen in a meaningful and systematic way.
What we need to do is go back and do some change management, because being in this room for me feels like being on my Facebook page. I can say what I want in the hall. Everybody always with a little like or a little heart because we all agree. The only thing why we are sitting together here is because we are all believers that this is going to bring better outcomes. And me, as an individual, as a taxpayer, I am a convinced person that this is also going to make healthcare more sustainable. So altogether, we are not part of the problem, we are part of the solution.
Industry tends to focus on numerical operational metrics, patient recruitment, dropout rates, all of which are very easy to measure. The measurements around trust, reputation, education, motivation were probably featured higher than I expected.
What we will have to achieve is something that is general enough to fit for everybody, but specific enough to make sense for everybody.
Doing a good job of FMV and using the FMV information is going to be hand in glove with the contracting issues that we discussed yesterday, very much so. Also, kind of thinking about the human factors and just being patient-centered in general. And then lastly, common sense.
The event is actually quite unprecedented. It is one of the biggest patient engagement gatherings in Europe.
It's been really great. I mean, it's fantastic to see such a huge room full of people all interested in patient engagement.
It's the richness of data and the richness of those conversations that have come out from such a diverse group of people that really you really wouldn't have on any other platform.
The sessions have been really thought-provoking, and yeah, it's really got me thinking about how we can improve things in our organisation.
I think it's fantastic. I mean, bringing together patient organization, academics and industry is really the way forward.
What inspires me is that there is a very collaborative spirit between the different participants, academia, industry, patient organizations.
At the end of the session, when it was coffee break time, people didn't want to leave. They kept on talking and asking more questions and having more conversation. And so that kind of energy supports and feeds into the kinds of things that we're seeing.